Warm greetings to everyone following the channel. Welcome back to our small home for senior healthcare, where we explore simple but very useful scientific knowledge to protect and maintain physiological health as we enter middle age and older years. Perhaps many gentlemen have heard somewhere about the concept of the male G-spot, which some scientific documents also refer to as the P-spot. This is a rather interesting topic, but still quite unfamiliar to many people, especially when talking about sexual health care after the age of 50. In fact, according to many studies published in the Journal of Urology, as well as assessments from experts such as Dr. Abraham Morgentaler, the prostate plays a very special role in the male physiological system. It not only affects hormones, but is also related to satisfaction, physical comfort, and mental well-being. Today, we will explore more deeply the topic of prostate massage. This subject may help you better understand your own body and learn how to care for yourself in a scientific and safe way. Before we begin, if you have not yet subscribed, I encourage you to press that button and turn on the bell so you never miss useful health tips made just for you. If you find today's topic helpful, please type the number 1 in the comments. If you are not fully satisfied, please type the number 0 so I can continue improving the content even further. E. The prostate, location and role in the male body. Inside the male body, there is a small organ that plays a very important role, but many gentlemen often pay little attention to it. That is the prostate. When young, this gland usually functions quietly without drawing any attention. However, as men enter middle and older age, many begin to hear more about it, especially when problems related to urinary and male physiological health appear. In terms of structure, the prostate is about the size of a small walnut. It is located right below the bladder, surrounding the upper part of the urethra. Because of this special position, any change in the prostate can directly affect urination, which is a problem many gentlemen over 50 begin to experience. The most important function of the prostate is to produce part of the fluid in semen. This fluid nourishes and protects the sperm and creates a favorable environment to help them survive while moving through the female reproductive tract. In addition, when a man reaches the peak of pleasure, the prostate also contracts to help push the fluid out. This is why this small organ is often mentioned when discussing male vitality and sexual health. Besides these biological functions, the prostate is also surrounded by a fairly complex system of nerves. This nerve system connects closely with the center that controls satisfaction and relaxation in the body. Therefore, gently and properly stimulating the area around the prostate can sometimes bring a sense of comfort and ease for some people. However, as age increases, the natural aging of the body also makes the prostate more prone to problems such as inflammation, enlargement, or dysfunction. According to data from the American Urological Association, RUA, the percentage of men over 60 experiencing prostate enlargement is very high. This condition leads to symptoms such as nighttime urination, fréque urination, weak urine stream, or difficulty starting urination, causing considerable inconvenience to daily quality of life. Because of the close relationship between the prostate, hormones, urinary health, and male physiology, properly understanding this small organ will help gentlemen make scientific healthcare choices and actively prevent potential risks as they enter old age. Why the prostate is also called the male G-spot. In recent years, the concept of the male G-spot has been mentioned by many people as a special area on the body where many sensitive nerves are concentrated. This area can bring relaxation and comfort when gently stimulated. In fact, the male G-spot is the prostate, which is located just in front of the rectum. right below the bladder. Because of this location, it can be accessed indirectly through the rectal wall from inside the anus. The interesting part lies in the complex nerve system surrounding the prostate. This area contains many nerve endings related to the body's natural sense of pleasure. When these nerves are activated safely and gently, the brain can receive pleasant signals, creating a sense of relaxation for the body. This factor has led many experts in the field of hormones and male physiology to refer to it as the male G-spot. According to analyses from studies published by the NIH National Institute on Aging and the opinions of many leading experts, the comfort felt when stimulating this area does not come only from the prostate itself, but also involves the entire pelvic region, including the pelvic floor muscles, the perineal nerves, and the small blood vessels that nourish this area. The harmonious coordination between the nerves, circulation, and mechanics creates a special relaxation effect when this area is properly stimulated. However, it is important to emphasize that not everyone experiences the same sensation when this area is stimulated. Some people may feel clearly comfortable, while others may not have any noticeable reaction. This depends on each person's body, sensitivity threshold, and overall hormonal health. In addition, many people mistakenly believe that stimulating the male G-spot can treat conditions such as prostate enlargement or urinary disorders. In reality, current scientific documents have not provided solid evidence to prove this. Stimulation of this area should be understood as a way to support relaxation, not as a treatment method. Better understanding how the prostate functions and its connection with the nerve system around the pelvis will provide gentlemen with valuable knowledge for safe male physiological care, especially as age increases. Accurate scientific knowledge will always be a reliable companion on the journey of personal health care. Sen, prostate massage, history and applications in medicine. When mentioning the concept of prostate massage, many people often think only of the aspect of supporting sensation. However, in medicine, this technique has a fairly long history of application, especially in the fields of urology and prostate inflammation. Since the early 20th century, before the development of modern imaging and microbiological testing methods, urologists used prostate massage as part of the examination and treatment process. At that time, if the patient showed signs of prostate infection, the doctor could gently perform manual manipulation through the rectum to help express fluid from the gland. The collected fluid would then be tested to identify the bacteria causing the inflammation. This allowed the doctor to determine the type of pathogen and select appropriate antibiotic treatment. At that time, prostate massage was valuable not only for diagnosis, but was also expected to help cleanse the inflamed area and support the patient's recovery. However, as medicine advanced with the development of urine tests, ultrasound, and blood tests, diagnosing prostate inflammation today no longer relies heavily on the massage technique. In addition, there were also periods when some doctors believed that performing regular prostate massage could help prevent fluid stagnation, thereby supporting the prevention of prostate enlargement or male physiological disorders. However, according to evaluations from recent studies published in the Journal of Urology, scientific evidence showing the effectiveness of preventing or treating prostate diseases with this method remains insufficient and has not been widely recognized in modern medicine. It is important to emphasize that although prostate massage once had a role in medical support, it has never been considered a mainstream treatment method, especially for the elderly. Performing this method without a doctor's consultation may carry risks such as mucosal damage, bleeding, or even worsening existing urinary conditions. Understanding the medical history of prostate massage will give gentlemen a more comprehensive view of this technique. Instead of seeing it as a treatment solution, Many consider it an interesting health topic that should be explored properly and safely under expert guidance. C. Benefits and risks of performing prostate massage. In the journey of male physiological care and prostate health, many middle-aged and elderly gentlemen have heard of performing prostate massage as a way to support health. However, to apply this technique safely, we need to clearly understand both the potential benefits and the possible risks. On the positive side, when prostate massage is performed properly and gently, some people may feel a certain relaxation in the pelvic area. The reason is that stimulating the prostate area can help soothe the pelvic floor muscles, support blood circulation in this region, and thus bring comfort to the person performing it. For those who often experience pelvic tightness, discomfort while urinating, or lower abdominal pressure, relaxing the pelvic muscles may help improve daily activities to some extent. Some people have also reported that after applying prostate massage, their sense of vitality and mental comfort seem to improve. However, these effects are individual and cannot be considered universal for everyone. Each person has a different body constitution and sensitivity threshold, so it is not possible to expect the same reaction from all. However, alongside the benefits, prostate massage also carries several risks if performed incorrectly or on the wrong individuals. First, the rectal mucosa, where the prostate is accessed, is very thin and easily damaged tissue. If performed too forcefully or carelessly, small scratches, bleeding, or bacterial invasion may occur, leading to urinary or pelvic infections. In addition, for gentlemen who are suffering from conditions such as acute prostatitis, urinary tract infections, or have a history of prostate cancer, performing prostate massage may worsen the condition. These cases should not attempt the technique without strict consultation from a specialist doctor. Moreover, many people mistakenly believe that frequent prostate massage can reduce the size of an enlarged prostate or improve symptoms such as nighttime urination or weak urine flow. In reality, current clinical studies have not found convincing evidence to confirm the therapeutic effectiveness of this technique for prostate conditions. This is an important point that gentlemen need to remember to avoid placing excessive or misplaced expectations. The key factor when discussing prostate massage is safety and proper understanding. This technique should only be considered an additional topic for exploration when one has stable health and doctor consultation. Each elderly person should carefully weigh the relaxation benefits against potential risks before deciding to try it. Woo! How to perform safe prostate massage at home. For elderly gentlemen who are interested in exploring prostate massage as a method of relaxation and comfort, support, understanding how to perform it safely is essential. Even small mistakes in the procedure can cause unwanted damage to the very sensitive urinary and prostate area. The first thing to prepare is hygiene. The person performing the massage must thoroughly wash their hands with antibacterial soap. If using bare hands, clean medical gloves should be worn. Fingernails must be trimmed and smoothed to avoid scratching the sensitive internal tissue. This simple step is very important to prevent infection after the procedure. Lubrication also plays a crucial role throughout the process. Unlike other areas, the anus does not naturally produce lubrication. Therefore, it is necessary to use a specialized anal lubricant with proper pH balance to reduce friction and make finger insertions smoother. Using enough lubricant reduces the risk of soft tissue damage and makes the experience more comfortable. Once preparation is complete, the insertion should be done very slowly. The person gently inserts a finger into the anus, going in about 2 to 4 centimeters, with the fingertip pointing toward the navel. At this location, one may feel the surface of the prostate as a round, soft, slightly raised bump, similar to the tip of a nose. This is the area to be gently stimulated throughout the process. Finger pressure should remain moderate, just enough to feel the surface without causing pain or discomfort. If any tension or sharp pain is felt, the procedure should be stopped immediately. Some people may feel relaxed within a few minutes, while others may need more time to adapt to this unfamiliar sensation. Besides using fingers, there are now prostate massage devices available on the market designed specifically for safe home use. These devices are often curved properly to reach the correct position and are made from safe, easy to clean materials. However, gentlemen should choose reputable brands and avoid poor quality products that may harm sensitive tissues. During the entire procedure, a relaxed and unhurried mindset is key. Always remember that the prostate area contains a complex nerve system, and stimulation should only remain at a level that creates gentle relaxation. Any rough actions carry unnecessary risks to urinary and physiological health in older men. Luke, common misunderstandings and scientific advice. When discussing prostate massage, besides the mentioned benefits and risks, there are still many misconceptions that elderly gentlemen often hear from friends, on the internet, or even in health experience sharing groups. Properly understanding this knowledge will help gentlemen make safer and more scientific decisions for male physiological health in old age. One of the most common misunderstandings is the belief that regularly performing prostate massage can treat or completely prevent prostate enlargement. In reality, prostate enlargement mainly results from the natural aging process, changes in male hormones, and the complex activities of hormones in the body. Although gentle stimulation may create temporary relaxation, no medical research has confirmed that it can reduce the size or stop the growth of the prostate. Another common belief is that prostate massage will improve urinary function, reduce nighttime urination, précurination, incontinence, or weak urine stream, which many men over 60 experience. In fact, modern studies published in specialized journals such as the Journal of Urology have shown no solid scientific basis proving a direct link between massage techniques and improvement of urinary dysfunctions. These symptoms are mainly related to the overgrowth of glandular tissue that narrows the urethra, not due to fluid stagnation, as some people mistakenly believe. In addition, there is also the opinion that every man can try prostate massage as a home health care method. In reality, this is a rather dangerous belief. Those who are suffering from conditions such as acute prostatitis, urinary tract infections, or have a history of prostate cancer should absolutely not attempt this technique without medical consultation. Performing stimulation at the wrong time can not only cause pain but may also worsen existing conditions. From a scientific perspective, prostate massage, if performed carefully and under expert guidance, may bring certain relaxation. However, it is not a treatment for prostate diseases or male physiological disorders. Each person needs to listen to their body, have regular checkups, monitor important health indicators, and especially seek advice from medical professionals before applying any care techniques involving this sensitive area. With the development of modern medicine, gentlemen today can access many well-founded, safe, and sustainable methods to support male physiological health in old age through proper nutrition, scientific exercise, and official medical treatments. Thus, throughout today's journey, we have explored a topic that may be quite new, but carries meaningful value for male physiological health in old age. That is the exploration of prostate massage and the knowledge surrounding the area known as the male G-spot. From a scientific perspective, we have seen that the prostate truly plays an important role, not only in the urinary system, but also in maintaining hormonal balance and natural relaxation in men as they age. Although gentle stimulation of the prostate area may bring some comfort to certain individuals, it is not a treatment for prostate conditions such as prostate enlargement or urinary disorders. More importantly, not everyone is suitable to try this technique. Those who are experiencing inflammation, urinary tract infections, or have a history of prostate cancer must be extremely cautious and always consult medical professionals before making a decision in middle and older age. Our body is like a precious garden. Caring for male physiology, the prostate, or the urinary system requires patience, science, and caution, just like tending each plant and blade of grass in that garden. Besides techniques such as prostate massage, gentlemen can absolutely maintain stable health through proper nutrition, gentle physical exercise, and regular health checkups. If you find today's information helpful, please subscribe to the channel and turn on the notification bell so you do not miss upcoming content on senior healthcare. In the next video, we will share simple exercises to strengthen the pelvic area, support the reduction of incontinence, and improve urinary health effectively for elderly gentlemen.